Welcome to Jiva Yoga Live. I'm Hillary. In this video, we're going to talk a little bit about tightness in your hip flexors. What are some of the symptoms, causes, and solutions? We're going to talk about some symptoms of tight hip flexors. So first of all, what are hip flexors? They're a group of muscles. They're located at the tops of the thighs that help give the body, the legs range of motion. They help us be able to lift our knees and bend at the waist and create flexion. So the opposite of flexion is extension. And when we're feeling really tight in these muscles, we're not able to extend fully, or if we do extend fully, we often end up with injury because of lack of flexibility in these muscles. So what are some symptoms of some of the tightness that you might be experiencing? The most common symptom of tight hip flexors is definitely pain in the lower back, especially after activities where you're spending a lot of time bending, lifting, jumping, or running. Perhaps you're a runner, do a lot of exercise. This gives a lot of stress on the hip flexors, and when they're shortened, when they're not properly stretched, even these simple activities can be quite burdensome on the hip flexors. Another hip flexor symptom could be pain in the groin area and the inside of the hips that might result in sensations of cramping or even causing you to be limping while you're walking. This is going to be some attention that's really needed for stretching the hip flexors. And a little test that you can do to determine how tight, how short are your hip flexors is simply just lay down on the ground into a shavasana, into a corpse pose. And then just notice how much of an arch you're having in the lower spine, how far your spine is coming off of the mat. If you're able to just relax the spine neutrally, it's really indicative that you have a nice openness in your hip flexors. If there's a lot of curvature in the spine, it could mean that your hip flexors are pretty tight. It might be time to give them a little more attention. So what are the causes of tight hip flexors? Well, like we mentioned at the beginning of the video, it's related to an extended time of flexion, of flexed muscles. And this happens in the hip flexors when we're spending a lot of time seated. So this could be a symptom you're having if you spend a lot of time at a desk, if you're spending 8 to 10 hours a day seated at a desk, or driving in a car. That's definitely working on your hip flexors. It's not allowing them to open, to be extended. They're always tight and flexed. If you're spending a lot of time doing explosive movements without properly stretching, this could be martial arts, it could be dancing, it could be sprinting. If you're not doing proper stretching with these explosive movements, it might be causing the muscles to stay flexed, to stay tense, and then resulting in pain that we've discussed. So there's no one specific reason for tight hip flexors, and equally there's no one solution. The best way to approach this problem is through a holistic approach, seeing the whole body as an opportunity to open more. You know, what's good for your legs is going to be good for your arms. What's good for the hips is going to be good for the spine, and it all works together. So just finding ways to create more movement throughout your day, to create some gentle stretching. If you're spending a lot of time sitting, you know, just take just a minute to stand up, do some little hip circles, some static in-place lunges, a little raise the arms above the head, anything you can do to just give yourself a little more mobility. If you create this, if you work this into your daily routines over time, you're definitely going to create more flexibility, and the more flexibility you have, the more range of motion, the less tightness you're going to experience, and the less pain you'll experience as well. The hip flexors are a large group of muscles, and that means that when we're not paying attention to them and giving them the attention that they need, what happens is they can pull lots of things out of alignment, and that's just going to result in more problems of imbalance and pain. So I highly encourage you, if you feel like you're having tightness in your hip flexors, to really incorporate 1 or 2 movements into your day, be consistent with it, and see what happens in just 1 or 2 weeks, how you're feeling, and if you're feeling more open, more relaxed, and with less pain. Thanks for joining us here at Jiva Yoga Live. Hope you enjoyed today's video. If you did, be sure to subscribe and click that notification bell so you can get alerts about future videos. Namaste.